Thank you very much, everyone. It's a pleasure and a privilege to speak here today, and thank you for the opportunity to share the research, and I'm very grateful to the RAIN Foundation for making this happen. So, Western Australia has one of the highest incidences of mesothelioma. This is a cancer which is caused by asbestos exposure. It's a cancer which invades the chest cavity, and it surrounds and encases and invades both the lungs as well as the chest wall. Patients experience a lot of pain, breathlessness, and ultimately succumb to this disease. One of the most important treatments which has emerged in recent years for mesothelioma is a chemoimmunotherapy treatment. Now, chemoimmunotherapy treatment is a new treatment paradigm, and what it does is it improves survivorship and also improves outcomes for patients. However, what we find with this chemoimmunotherapy treatment is that patients don't necessarily respond to treatment all the time. Part of our role as oncologists in my clinic is to help them navigate the side effects versus the potential benefits of such treatment. So understanding who responds to treatment and who does not is an important research question. Now, in order to explore this question in more detail, what we did was we analyzed patient samples, blood and tumor samples, from a mesothelioma clinical trial. This was a clinical trial of mesothelioma patients treated with immunotherapy, where we knew the responders, namely patients who did well, and patients who did not do well on treatment. I had the opportunity to learn from world experts in this area and learn how to computational skills and how to use the computer properly. The results of these thousands of hours of computer analysis and the result of this research is encapsulated in that image over there. What you're seeing here is our patient blood cells with each individual speck representing a blood cell from one of the trial participants. What we discovered from this research was that patients who respond well to treatment have specific cells in their bloodstream which are linked to treatment response. And therefore, this provides a very simple but powerful strategy for predicting treatment outcomes. What this means with this project completed is that we now have a test for predicting whether a patient will respond well to treatment. We can take tumor samples, pair them with information from patient blood samples, and provide information to patients who are on their treatment journey as to whether or not they will respond well to this chemoimmunotherapy treatment. Patients who are predicted to respond well will go ahead and continue on treatment and improve their survival. Patients who don't respond well, who are predicted not to do as well, will pivot to different treatments, and therefore that protects them from both the toxicities of treatment and also improves outcomes, because it also allows them to seek different methods for treating their mesothelioma. And essentially, I thank you very much for listening to this. I'm very grateful for the opportunity to have done this research in the last many, many years. I've learned many new skills and met many people whom I admire. And thank you very much to the audience. Thank you to the RAIN Foundation. Thank you to the patients. And thank you to those world-leading researchers who were my mentors. Thanks for listening.